Skin cancer is an area that has seen exponential increase in innovation over the past few years. The WCCS 2014 scientific program reflected this, covering important topics including the discovery of new signaling pathways such as BRAF, hedgehog, ATF3 and NRAS as new targets for drug delivery, the role of T cells and advances in diagnostics. Here, Professor John Hawke and Professor Claus Garbe give their thoughts on some of these exciting developments.
The whole conference is full of excitement, but because the field is advancing very rapidly in all directions. But I suppose one of the most exciting things is the development of new treatments for the killer disease of melanoma.
We have these new developments in treatment of metastatic skin cancer, mainly melanoma, but there's a similar interesting development also in metastatic basal cell carcinoma, where we have targeted therapies and immune therapies, and they are exemplary developed in melanoma as the first tumor, and now they are also tried in other cancers like lung cancer, renal cell cancer, and so on. So these are the main two reasons why skin cancer has become much more important as compared to previous decades. We develop a new understanding of the effects of immunological therapies. So the classic understanding of an immunological therapy is that the T lymphocytes kill the tumor cells. And this is true to a certain degree, but not all tumor cells are killed. And then there is a second mechanism which is also mediated via T cells. They secrete cytokines like TNF-alpha and interferon gamma. And these cytokines drive tumors into a senescence. That means they go into a dormant status. They are still present, but they do not grow anymore. And so this is probably a new concept how to treat tumors, not to eradicate them, but to bring them under control. And I think these are the most exciting messages of this conference. In terms of diagnostics, we have some new devices, let's say to diagnose with measuring impedance of the lesions, so electrical devices, or also new devices for imaging diagnosis. There are several ones. And what also develops is to determine certain molecules from the blood indicating the presence of tumor or the absence of tumor. And even today there are attempts to measure the mutations via RNA molecules in the blood. Yeah? And so these are interesting developments, and we will see how much comes to the routine daily practice.